What's up, beautiful people? Another day, another study. So, circadian physiology is a growing area of interest among scientists and clinicians. We know that our circadian rhythm is very important for hormonal health, cardiovascular health, metabolic health, recovery and repair, all of these things. And so, we've seen evidence supporting that in people who have metabolic dysfunction, that meal timing may impair certain aspects of cardiovascular health and metabolic health, or may improve those things depending on when we do it. During sleep, glucose utilization, metabolic rate, and the sympathetic nervous system, the fight or flight arm of the nervous system, activity should drop. And when it doesn't drop, that can be a problem. Eating within 2 to 3 hours of sleep onset when melatonin levels are rising may impair aspects of metabolic health. This randomized controlled trial compared extending the overnight fasting window to at least 3 hours before bed on several metabolic parameters. Light exposure was reduced to less than 100 lux before bedtime in both groups, and that was the control for the circadian impact of light exposure. And adherence to the study intervention approached 90%, which is great. That means many people over the 7.5 week duration of the study found that it was easy to adhere to the intervention. So the overnight fast was nearly 15 hours in the intervention group. Last meal was about 4.25 hours before bed, compared to nearly 12 hours in the control group, and the last meal was about 2 hours and 40 minutes before bed. There's no significant change from baseline in total calories, calorie distribution, BMI, or waist circumference in either group. The intervention group showed a reduction in heart rate variability, nighttime cortisol levels, nighttime diastolic blood pressure, nighttime dipping of diastolic blood pressure and heart rate. And that's very important. So we know that if everything is going well in your circadian physiology, that your blood pressure and heart rate should go down at night. It should be higher during the day. And when that doesn't happen, we see in previous studies increased risk of cardiovascular disease and even all-cause mortality risk. So that nighttime dipping is a good thing. In fact, 60% of the intervention group converted from non-dippers to dippers for either systolic blood pressure, diastolic blood pressure, or heart rate, compared to 25% in the control group. So what that is showing is a better autonomic, a better nervous system control when these people did the intervention. We also saw that there was an improvement in glucose levels on an oral glucose tolerance test. Their mean glucose levels 60 minutes and insulin levels 30 minutes after the test were also lower in the intervention group. No changes were seen in sleep macro architecture, so they measured a variety of different sleep parameters between the groups. Now, of course, there are significant limitations. This was a small study. We cannot extrapolate this study to metabolically healthy people. Participants had metabolic dysfunction at baseline. They were either overweight or obese on average. A1C was 5.6. So right there at the cutoff of prediabetes. Prediabetes is A1C of 5.7. Many of us would already argue that at 5.6, we're already showing metabolic dysfunction. That a fasting glucose of 102, which is actually in the prediabetes range, and a waist circumference between 98 and 107, which depending on male or female, that can be problematic. There are lots of exclusion criteria. It was a short trial duration. It was reliant on self-reported data for sleep and meal data during the intervention. They did bring them in a lab to measure the autonomic stuff and the glucose tolerance and all of that stuff and do sleep studies. So overall, this adds to the overall body of literature. For people with metabolic dysfunction, aligning meal timing with our circadian physiology may improve aspects of metabolic health. In this case, autonomic control, so things like blood pressure, heart rate, and how our body responds to glucose intake.